Shortness of breath. Shortness of breath is a symptom associated with serious conditions like congestive heart failure (CHF), chronic obstructive pulmonary disease (COPD), and asthma. If the cause of shortness of breath is unknown or unconfirmed, it is recommended to see primary care physician (PCP) as soon as possible. To help keep chronic shortness of breath from getting worse, patients should stop smoking. Once the patient is tobacco-free, the risk of heart disease, lung disease and cancer begin to drop, even if the patient has been smoking for years. Follow the treatment plan the doctor has prescribed. If the patient's current treatment plan is not working, or the patient doesn't understand how to use the medication and/or inhalation device prescribed, schedule an appointment with the patient's PCP as soon as possible. Avoid exposure to pollutants as much as possible. Avoid breathing in allergens and environmental toxins. Lose weight if necessary. Maintain a healthy diet. Have an action plan. Discuss with PCP what to do if symptoms become worse. Avoid physical exertion. If patients rely on oxygen, be sure that supply is adequate, and the equipment. Seizures and epilepsy. Seizures are involuntary, often violent, contractions of muscles. They can involve a small area or entire body. Seizures are caused by abnormalities in the brain and may affect not only muscle control and movement, but also speech, vision or eye movement, and awareness or behavior. Epilepsy is a neurological medically diagnosed condition that makes people susceptible to seizures. Sometimes it is called a seizure disorder that can develop at any age. Seizures are chronic, ongoing and frequent, and may happen without known cause. Triggers of seizures are the following: stress, excessive excitement, overstimulation, excessive fluid intake, extremely low blood sugar in patients with diabetes, sunlight, heat or humidity, flickering lights, skipping meals and poor nutrition, illness, high fever or allergies, lack of sleep, withdrawal from certain medicines, illegal drugs or alcohol, missed anti-seizure medications. Responding to seizures. If a patient is experiencing seizures, seek help and call 911 immediately. Report the emergency to the supervisor. The main goal during a seizure is to make sure the patient is safe. During a seizure, a patient may shake severely and thrust the arms and legs uncontrollably. The patient may clench the jaw, drool and be unable to swallow. Remember, stay calm. Most seizures last only a short time. Make sure that you note the time the seizure started. Use gloves at all times. Do not restrain the patient during the seizure. Do not try to stop the seizure. Protect the patient from injury. Lower the patient to the floor. Move hazardous objects out of their way. Do not put anything in the patient's mouth. Roll the patient to one side once the seizure is ended, and if it is safe to do so. Note the time. Place something soft under the patient's head. Loosen tight clothing and remove objects such as glasses. Check for adequate breathing and pulse rate. Monitor the patient's condition and stay with the patient until 911 arrives. Responding to heart attack. The pain of a heart attack is commonly described as a crushing, pressing, squeezing, stabbing, piercing pain, or like something is sitting on my chest. The pain may go down the inside of the left arm. A person may also feel it in the neck and/or jaw. The pain usually does not go away. To recognize the signs of heart attack early and call for help, it is important to remember that women may have a heart attack without chest pressure. Women are more likely than men to have shortness of breath, nausea, lightheadedness, stomach pain, sweating, fatigue, as well as back, neck or jaw pain. Some women's symptoms seem more flu-like, and women may even deny having a heart attack. A home health aide must take immediate action if a patient shows signs and symptoms of heart attack. The below guidelines must be followed by home health aides to respond to a heart attack emergency. Seek help and call 911 immediately. Place the patient in a comfortable position and provide reassurance. Loosen clothing around the patient's neck. Do not give the patient any liquids or food. Make sure that help is on the way and monitor the patient's breathing and pulse rate. Stay with the patient until help arrives. Notify and report the situation to the agency's supervisor. Emergency room and urgent care. If the patient's condition is not life-threatening, but needs to be taken care of right away, urgent care instead of the emergency room may be the right choice for the patient. Urgent care centers are usually open after normal business hours, including evenings and weekends. Offer on-site diagnostic tests. Patients may save time and money by going to an urgent care instead of an emergency room. Emergency rooms are the best place for treating severe and life-threatening conditions, such as heart attack or uncontrollable bleeding. Remember, the patient's primary doctor, PCP, is the best place to start when your patient first gets sick or hurt. PCP can help control your patient's condition before it reaches a level that requires emergency care.